So this is the facility where we provide physical therapy services. As it can be seen, there's a lot of emphasis on exercise. So for patients who need more extensive exercise work, the very basic elementary exercise work can be done in the treatment rooms, but people who need more extensive exercise that can be done here because we have more space, and that's primarily provided by the physical therapist. And so, but again, as one can see, it's not complex or high-tech or expensive equipment. It's basic stuff that is designed toward helping to facilitate people's ability to take care of themselves ultimately, and that's always where we're aiming toward. And so if you are overemphasis on high-tech equipment, then you're not well geared toward helping patients to learn how to take care of themselves on their own. And so we use a low-tech approach.
Yeah, and that also then has ethical implications as well, doesn't it? In the sense that if you create an exercise environment that is high-tech, that creates a sense of dependency for the patient, that can ultimately be constraining for them because they're not being empowered to do what they can do with their own equipment at home.
Mm-hmm.
This is the learning environment for them to then move on.
That's exactly.
Is that correct?
Yeah. So if there's one thing that I can say is the most important aspect of primary spine practitioner facilities and services, and the services of the pathway as a whole, if there's one thing that's most important there is patient empowerment. Empowering the patient to feel, to have self-efficacy, which means to be confident in their ability to overcome the problem and take care of themselves, even after they've recovered, if they've recovered fully or not fully, to be able to move on and get their life back without depending on practitioners and medical facilities, etc.
Right, excellent. Now, one of the questions that frequently comes up both in my practice and throughout the professional community is physical therapy and chiropractic. Now, you're working together in friendly association with a physical therapist. Tell us about that and tell us about how you see the two relating together and what your thoughts are on that.
Yes, so what this spine care program is, guided by the pathway, what this is about is helping patients overcome the problem as quickly as possible. And that means bringing professionals together who have the skills and knowledge to be able to help in whatever area that is their expertise. So it doesn't matter what their degree is, it doesn't matter whether they get along with their colleagues or whatever. What matters is, can they help the patient? Do they have the knowledge and skills to help their patients? That's where we focus. And so in the case of chiropractors functioning as primary spine practitioners and physical therapists providing what they do best to help the patient overcome the problem, again, it's about what is best for this individual patient. And whatever is best, that's what we do. And there's because of that, because we place the focus on the patient rather than on practitioners, there's no conflict between the practitioners because everybody is interested in the same thing, one thing, helping the patient get better as quickly as possible.
So essentially what you're then saying is, here's the patient right in the center. The physical therapist will have a skill set of X, Y, or Z. The chiropractor will have a skill set of A, B, and C. And the patient needs A, Z, and X. Mm-hmm. And that's then collaboratively applied for that patient to get them better.
That's a good way to put it.
Right.
That's exactly what.
Yeah. Which is excellent. And I think that breaks down a lot of the unnecessary bad blood between physical therapy and chiropractic.
Yes.
Certainly in South Africa, we've got a lot of that, which is a problem.
Mm-hmm.
There's this unnecessary rivalry between the professions, which who is the person who then is negatively affected? It's the patient.
Right.
Because the clinician often holds on to that patient applying inappropriate therapy when it could be collaboratively done in a sequential and an orderly process.
Correct. Yes.
So
yes, and certainly in the U.S. here, there's plenty of interprofessional animosity, And what we've done here successfully is rise above that
Right.
to, again, focus on what's best for the patient.
Yeah, yeah. And I think your baseline authority being a good evidence-based clinical framework provides that, doesn't it? It's the common language
Yes.
that you can speak with a physical therapist.
Yes,
Yeah,
correct.
Yeah.